Lead us from untruth to truth, from darkness to light, from death to immortality, to peace, peace, peace.
Hello, viewers. I am Chitra Krishnamurthy, the director of Nrityalaya, the School of Indian Classical Odissi Dance in Potomac, Maryland. Welcome to the Nrityalaya webinar series, Pursuing Passions to Heal, Her Story and Our Stories. While COVID-19 has presented many challenges, we have proceeded with choreography and would like to share with you some glimpses of the upcoming show. In the fall, we will be presenting Her Story, a dance portraying a woman's battle to overcome darkness by rekindling her passion for dance. To shed more light on the topic of depression, we are conducting a series of webinars. We now present the third pre-production webinar. We have assembled an esteemed group of panelists. The panelists include speakers who have openly talked about the malady called depression that has challenged them. The panelists also include therapists, the healthcare professionals who will give us further insight into this darkness and the healing and recovery process. We are calling these initial conversations pre-Her Story webinars, as these very same panelists will talk about their different paths to healing in the post-Her Story webinars. We will keep you updated and take this opportunity to invite you to view our presentation of Her Story. We hope you will join us at the online premiere. Recovery may not be the right word I'm looking for. I think I mean healing and the healing process. I am convinced that with the different kinds of help available these days and with modern technological innovations, we will conquer and move forward. I am positively cheering for hope in the future. Let's start our conversation with the panelists. We will conduct the discussion as a question and answer session. We are honored to have such a diverse panel today. I would like to introduce the speakers and the healthcare professionals here with us. The speakers for today are Ms. Florencia Schillaci and Mr. Terrell Jones. Ms. Florencia Schillaci is a senior at the University of Maryland, College Park, pursuing a degree in psychology and neuroscience. She's a medical assistant in Olney, Maryland. She's a member of the service fraternity at UMCP that helps children of immigrant parents with schoolwork. Her goals are to apply to medical school, and she wants to shadow doctors in Argentina, COVID permitting. Mr. Terrell Jones has a BA in psychology from the University of Florida and an Associate of Arts in Social and Behavioral Management. Currently, he works as a patient advocate ambassador at the Foundation for Sickle Cell Disease Research. His goals are to help patients with sickle cell disease in crises and otherwise, to help them to cope with their disease without opiate dependency. He calls himself a fighter and wants his story heard. Our healthcare professionals for today are Ms. Gabriela Romo and Dr. Christian Credo. Ms. Gabriela Romo is a clinical professional counselor. She has an MA in Development Studies from the School of Oriental and African Studies and a second MA in Mental Health from the Johns Hopkins University. She is in private practice in Maryland. She has also established a nonprofit organization for Latinos with multiple barriers. She specializes in immigration issues, family separation, domestic violence, and disorders related to trauma, depression, and anxiety with a cultural perspective. She provides professional opinion on mental health issues to the Latino community. Dr. Christian Kriegel is a clinical psychologist. He has a PhD from the Chicago School of Professional Psychology in DC. He has an MA from the American School of Professional Psychology at Argosy University in Virginia. He has a BA from Rutgers University, New Jersey. And now he provides therapy at the AIDS Care Group, a primary care center in Sharon Hill, Pennsylvania. He specializes in opiate addiction, HIV, LGBTQ programs, and he's a member of the LGBTQ Advisory Council. He looks forward to helping people lead rich, meaningful, and vibrant lives. Thank you, panelists, for being here with us today. I would like to start off this panel with a few questions for our speakers first. Ms. Kilachi, in the fall, we will be seeing and hearing about HERstory, our dance production. Today, we would like to hear from you about your story. Please share it with our viewers, addressing the following points. What were your experiences with depression? Did any specific event trigger depression, or was it random? Ms. Schillaci, over to you.
First of all, I appreciate the introduction. I am very happy to be taking part of this webinar, and I'd be more than happy to share my story in collaboration. So my story, my parents are both from Argentina. I was the first person in my entire family to be born somewhere that is not Italy or Argentina. I was born in the United States in 1999, and 2 years prior, my parents had moved here very shortly after they had gotten married. And also my brother was also born here. That was 3 years after me. And throughout my life, I've had different phases of depression. It occurred in different ways. For example, when I was 5 years old, my parents actually got divorced, which was really hard because I was 5. I didn't understand the concept. Suddenly, I didn't understand why my parents were in the same house, where all of my other friends, I would go to their houses and their parents would be together. I never understood the concept of it, and I was younger. And I also had a younger brother that I felt like I had to take care of him so he wouldn't be suffering the same way I did. And that continued until I was around like 10 years old, where I started seeking therapy, and that really helped me push through that. So I got better after that. But then when I went to when I went to high school, I was exposed to a lot of people who were not of the same ethnicity as me. And it was a moment in my life where I was very confused as to how I identified, because on one side, I was Argentine and Italian because that was how I was raised. It's my entire family is from. But at the same time, I was born in the United States. So I felt a very conflict internally. I didn't know which culture, which ethnicity, which race was the correct one. I didn't really know how to identify. And it was hard being in high school and only being surrounded by my white classmates who were not of Hispanic or Latino origin or any ethnicity. So that was very hard, and I really struggled with that. I really felt like I had a part of my personality that I kind of had to suppress because I had classmates who didn't understand it, who wouldn't really know what I was going through because they didn't have mixed families or different ethnicities in their backgrounds. So that was definitely a trigger that happened in high school. But fortunately, later in college, I was exposed to to students, honestly, from all over the world. And I realized I really wasn't alone in having that feeling. And that really helped me. It really helped me understand that, again, it's okay if it's not the same as everyone. Everyone has their own unique experiences. And it was nice to know I just wasn't alone.
Thank you. I'm going to ask the same questions as the next speaker, Mr. Jones. What is your story Please share it with our viewers, addressing again the same following points. What were your experiences with depression? Did any specific event trigger depression, or was it random? Mr. Jones, over to you.
So basically, my story comes from being born with HIV, also along with losing my mother at age of 5 due to drugs. I was living from one woman, my mom, to living with my aunt, then from my aunt living with my cousin. So just being switched from different homes to different neighborhoods, being bullied. And on top of that, growing up being gay was a thing that my family did not understand. And I didn't understand it at a young age. So that's what brought on to my depression. I didn't know how to understand it. I didn't know how to seek for help. And then also on top of that, being in the household that I was in, each home, we was taught not to seek for help when we're depressed. You come to your family and that's it. But what my family failed to realize, I didn't have family. I had to deal with this alone. Being gay, being born positive, dealing with sickle cell, my mom, my aunt, then they would just take me to the hospital and drop me off. Oh, he's in a crisis. Hospital keep me for weeks at a time. I get out of the hospital, and then I have to go from the hospital to home on my own. It wasn't like I had my family there to hold my hand when I'm going through a sickle cell crisis. So I was always left alone. And being a young man in the urban neighborhood was not always good for me because I was being bullied. I was not from that area. I was not raised in that area. And if I was living in that area, you can tell I was not from that area because the fact is, I ran track. And what made me run track is because kids used to bully me. So I ran from getting beat up. I'll run from teachers. I'll run from anybody because it was always the point of belittling me. Till I got to high school and I realized I'm not gonna run no longer. I'm not gonna hide. There's other kids in high school that went through the same thing I went through. So being accepted to University of Florida, being the first one in my family to graduate from high school and go to college, it's like that was an understanding for me to say, okay, you have to do better for yourself. So I strive to get my PhD and I strive to get my associate arts. It's because I wanted to make a difference in other people's lives. So up until Corona hit, I was working with the school board, working with kids that dealt with the same thing that I dealt with when I was a kid. So not just making a difference in my life, I was also making a difference in their lives too, as an adult. And I also got answers too in school. I realized why my mom chose drugs over her kids. I understood that once I went to college. I learned why or what was going on, why my family could not accept me for being the Black person, not being Black, but being the gay person that I am. And now I'm 30 years old and I love myself. I love myself, literally. And it took for me to understand that in college and in high school, I literally went through life just hating myself because my family hated me, or I felt that they hated me. But that's my story. That's how I started.
Thank you so much, speakers. Your stories are very moving. I will now turn to the healthcare professionals to get insight on their experiences. Ms. Romo, what have your experiences been with depression in the community? Ms. Romo, over to you.
Yes, well, actually, they're not too different from what the panelist said. For example, it's like that feeling that they don't fit in, that there are no understandings, around their home or the peers or with the people or the environment in which they are growing up. So that sense of isolation, of going through all these issues alone, is quite common among the people who have depression. And we have to remember that there's a lot of, stigma, barriers that, people don't know how to deal with this. So, and something else that I think that I want to mention about with people there are from minorities is that many times there are issues that come from childhood, in which this environment in which they are growing up, and that they have limited coping mechanisms, because this is all too new, and without any help, that becomes almost impossible. There's no guidance in dealing with this stress. Also, then depression becomes this progressive or fearful private problem that many times, actually sometimes they don't even know that they have depression or they're struggling with. So this goes in this private realm in which they struggle alone, they isolate themselves, and then it becomes very difficult as well to reach out to them. So, and something else that I want to mention is that any person who belongs to a minority, and they are more at risk of having depression. And this is because when we don't have these other protective factors that help us to deal with this stress, then we are more at risk. And I'm talking about, for example, having the support from extended family, having friends, being able to ask for help, that these provide the most help. And particularly when, they have people growing also outside their community, and they feel that pressure having to fit in. So from what they mentioned is kind of like, would say like very common. And it is, it is sad at the same time that it's been so common, and yet we don't talk about this. And so help is sometimes not that easy to access.
Thank you. I will ask the same question to Dr. Credle. What have your experiences been with depression in the community? Dr. Credle, over to you.
Hello. First, I want to say thank you for having me, and to the panelists, thank you for sharing your stories. I know that's going to be really helpful for the people that hear them. But just to speak to what depression looks like in the communities that I work in, as Ms. Romer was saying, very similar to what the other panelists are seeing. I think most of the people that I work with have had experienced depression, have had a depressive episode. And the predominant feelings of isolation, disconnection, meaninglessness, thoughts about wanting to end your life. They are just, they're in the work that I do with my community, especially talking about people that use drugs, people that are in a part of the LGBT community, people that have HIV, because of all of the external pressures, stigmas, disconnection from culture and community that these people experience. They're prone to have depression. And I think, as a therapist, I think, my job is to help these people make meaning, help these people make community, help connect people to their history, to their strengths. But it's very, it can be very tough when you live in a world that is not supportive of who you are, and you get stigmatized for the groups that you belong in just because of who you are. So yeah, depression is very common in these communities, and I hope we'll have time to talk about what to do from there. But we have some answers.
Thanks to both of you for your thoughts on the experiences of the speakers. Getting back to the speakers, Ms. Kilaki, did you face any stigma that deterred you from seeking help? If so, how has that affected you? People say, snap out of it. Can you really snap out of it? How would you perceive this?
Yes, I definitely faced a lot of stigma from seeking help. When I was younger and my parents first got divorced, they thought that because I was 5 years old, I wouldn't really notice. So I started seeing my school counselor. They didn't know about this, but I would go during lunch sometimes and just talk to her, but I wouldn't really talk about their divorce. I would very lightly mention it. I would just talk about other things. So I never spoke about getting therapy with my parents. I also didn't want to mention to them either, because I thought that by mentioning it, they wouldn't be very receptive of it, because as was kind of said before, for my family, it was very like, oh, you have a problem, well, just come to us. Like, you don't need to talk to someone else. Like, why? We know you better than anyone. There's no need to talk to anyone else. And you're just like, okay, well, not really. I can't do that. That very deterred me from seeking help. And actually to this day, I still struggle with like reaching out to my parents and being like, I think I am going through something. I think it'd be best if I talk to someone. And that has really affected me in the way that I now am a lot more cautious, or not more cautious, excuse me, it's hesitant to wanting to seek help, because I feel like it's okay, I can just talk to my parents about it. But to this day, again, I still don't talk to them about all the struggles I've been having in college and throughout my life. I'm more hesitant to telling them because I'm afraid of how they will receive it. And no, you really cannot snap out of it. It's not something that just goes away. I know it is a common thing to say, but unfortunately, the best way is to seek help. And fortunately, I've been able to get a lot of social support from my friends who have been in very similar situations as me, and they have really helped me through a lot of it. But in terms of therapy and more professional help, other than my school counselor when I was like 7 or 8, can't really say I've had that yet.
Thank you. Mr. Jones, did you face any stigma that deterred you from seeking help? If so, how has that affected you? How did the stigma of depression impact you from reaching out to others and seeking help? How did you overcome this depression, this stigma?
Well, as I said before, I think I got ahead of myself in my last speaking. I was raised in a household where they say, oh, we Black, we don't get counseling. Or you be fine, you good, you got tough skin, you get through it. People before us, our elders didn't have counseling. And I felt like growing up, I didn't need counseling because why? I was told that I'll be fine. I didn't need it. You good? Don't worry about it. You get through. Go ahead. And I was not okay. As you can see, I clearly wasn't okay. I sliced my wrist. I attempted to hang myself. I wasn't okay. And to my family, oh, don't worry about it. You get through it. Pray about it. Yeah, you pray about it because I was raised in a religious home at some points too. But at the same time, prayer. And then once I realized that I need help, but I didn't realize that until I was maybe 16, 17. And I was graduating from high school at the age of 17. So I was already far along gone to say, okay, I need help now. And that's when I started seeking and getting help and understanding that I needed help.
You speakers have been so forthright with your experiences with the stigma attached to depression. We will delve a bit more into this by asking the next two panelists about their experiences. This question is addressed to both Ms. Romo and Dr. Credo. When one has a broken bone, we let the injury heal with a cast, medicines, and physiotherapy. When one is ill with, let's say, the flu, we let the illness heal with medicines, fluids, and rest. However, when one suffers from depression, why is there such a stigma attached to it? What are some of the barriers or stigma that you encounter that inhibit people from seeking help? Let's first start with Ms. Romo.
Yes, of course. Unfortunately, as with any mental health issue, depression has a stigma attached due to how generally mental health is perceived, sometimes within the limitations of our culture, education, and so many other things that I'll mention briefly. Depression specifically is often perceived as being weak, crazy, unbalanced. And, we try to avoid being labeled as that, as mentally ill or being weak. Also, people have this strong feeling of feeling ashamed of having it, in part also to the negative nature of the illness. Now, I think that there was also a lack of understanding by family, by friends and others, as they mentioned, they're around us. And so that contributes to being seen weak, of being seen, that we are not doing well. So I think that there is a lack of education in general related to our emotions, dealing with them, mental health, and we don't speak about it either. But so specifically also talking about barriers that I see in minorities and in the communities of minorities is that, these, there is also the things that are private. So we don't talk about this outside their family. These are private issues, and you should not talk about those things to a stranger, right? Also, I see that, for example, in minorities in which actually they don't speak the language, then it becomes a barrier because, they want to talk to somebody who can understand that, and also, their language and also their culture. And that's super important. And sometimes it's like the, agencies and say, well, we have interpreters, but that's like an extra barriers, particularly when we're talking about something so private, so strong, so, personal. And so, and there's a lot of things that also go, those subtleties in culture that it's awful for the people actually that I've seen, particularly in the Latinx community, that they say, well, finally I went to see somebody, but, I had to kind of tell them exactly what I was trying to say because they couldn't understand me when they're talking about from the cultural point of view. So, and there are other things that are structural ways as well. So, for example, with minorities, often they don't have health insurance. Sometimes they cannot afford the services. It's difficult for adults sometimes to take time off from work and to tell their boss, like, I'm going to see my therapist because they feel like, where they're going to think about it, or that, I cannot even perform my job anymore. So we see that is like a structural systemic barriers, but also these other perceptions that we have around mental health. And all this go into the same pot and it mixes. And so it makes it very difficult for somebody who is struggling with something as strong as depression.
Thank you. Dr. Creedle, your thoughts?
Yeah, I agree a lot of what Ms. Romo had to say. I see a lot of the structural barriers for people getting into care, getting in touch with care, knowing that there are resources out there like psychotherapy, like medication. A big barrier is that, historically, especially when I'm thinking about more minority populations, they didn't have access to this, or when they got access to these types of resources, there were very negative experiences where people were taken advantage of or injured. So communities, when I'm thinking of the Black community specifically, there, as one of the panelists was suggesting, there is this thought of like, let's keep it inside the community because that is viewed as safe. It's viewed as safe, it's viewed as protective. We're going to stay stay within ourselves as a response to the environment that, living in the United States of America. And then that cuts us off from getting access to therapists, from us becoming therapists and being able to help the people that we're working with. So that, again, as Ms. Romer was saying, when you come to an office, you see somebody that looks like you, and somebody that might have a similar cultural experience to you, someone who may share the same sexual minority status with you, so that you know that there's some comfort there. And another thought that I had was culturally, sometimes depending on where you're from, might be a little easier to think about some of the emotional sort of symptoms of depression and anxiety, like you feeling issues in your stomach, you have a headache, you have tension in your body. A lot of times those things that are just symptoms of depression and anxiety get attributed to physical things, and it's a little easier to say, oh, I have a headache, I have this, than really examining, incorporating that, oh, it might be depression, and that I might need to talk to somebody about stuff that's painful and share things about the family that I live in that bring shame. So I think those are a couple of, just a few areas of where the stigma comes and where the barriers come to people talking about their depression.
Both your reflections from a healthcare point of view, I'm sure, are extremely useful. Going back to you, Ms. Schillaci, we will discuss your specific journeys to healing after our dance production in the post-production webinar series. In HERstory, the main character, Her, is portrayed as an ordinary woman who is coaxed by her family, dance mates, and therapists to use her passion for Odissi dance to overcome her depression and to launch her on her journey to healing. My question is this: could you have started your journey to healing without help? Also, since we are in the midst of a pandemic with innumerable challenges, could you please tell our viewers if the COVID-19 disease or the lockdown impacted your depression or your healing in any way? Ms. Schillaci.
Excuse me. Thank you. Definitely, it would have been a lot easier to have gone through my journey, I guess, with more help. As was said before, I was also told, oh, we're Christian, like pray about it and it will go away. And that's not really how it works. So my journey to healing would have certainly gone faster, I believe, if I had gotten more help, more professional help. However, I am grateful for the course that it took, because it did teach me a lot of self-love that I don't know if I would have gotten the same feelings now towards myself had I approached this another way, just because I am not sure. But no, I would not have been able to get through a lot without the support from my friends and a bunch of resources. What I did a lot when I was feeling especially awful was I played a lot of soccer. I channeled all my emotions and energy. I was doing great in school. I didn't really have to focus more on that, but I needed to get out all the frustrations, all my emotions in a more physical way. And I played soccer for hours each day. And that really helped me a lot. It helped me get my energy out, and being able to share that with other people, play soccer, even though I didn't tell them what I was going through. It was nice because I was accompanied somehow. It was a nice way of just releasing so much. And during the pandemic, during COVID, it definitely helped more in my healing way, because I was actually forced to listen to myself. I couldn't anymore just ignore my problems or just put them to the side like I always do. I was now playing soccer anyway by myself, but it was still, I was more forced to think about while I was playing. I can think more about what I was feeling, what I was going through, what my challenges were. It definitely helped me a lot in the healing process, because I was forced to dedicate time to myself, something which I never do during a regular schedule or regular year.
Thank you for your frank comments. Let me now ask Ms. Romo and Dr. Creedle questions along the same lines. This last set is addressed to both of you. Could you briefly touch on the fact that help is now available without specifying what could be tailored to each individual? Also, how has COVID-19 impacted depression in the community? We will start with Ms. Romo.
Yes, well, help is available to anyone who is struggling with depression or any other mental health issue. You know, there are governmental or agencies also who are obliged to provide services in other languages. I know that this is not perfect, but, you know, with an interpreter, it helps at least, but that help is available. You know, people, when they are struggling and they are in crisis, they can call 911. Each county in this country has a crisis center who is open 24/7, and it does regardless of the legal status. There is also the National Hotline for Suicide Prevention, which is the 800-273-8255, the National Helpline 1-800-662-4357. And all these places are private, confidential, and they will make the appropriate referral. They also have people who work in the private sector, put it that way, in the private practice, and they're also, belong to minorities as well. So they're culturally competent. Sometimes the people provide, a lower fee rate according to the person's income. Also, there are NGOs, non-governmental organizations that provide services as well at low cost or no cost at all. So all this is available. Now, how this has impacted, how COVID has impacted depression, the community, in the community. Well, I have to say that for a lot of people, it just got worse. So people who had already pre-existing disorders, things just got worse. For people who didn't have anything, they started to have, the symptoms of depression, of stress, anxiety as well. So all this increased. We know that with any pandemic, depression escalates, depression increases. And something else that I saw was that some people unfortunately stopped treatments. Those who were already there getting help, they didn't want to transit to having telehealth or e-visits, feeling that it was not too private. At least that's what I saw in the Latinx community. And so they felt that didn't have the personal touch or the flow of talk. And so they preferred to wait. Things are getting better nowadays, but also we have to admit as well that, for a lot of people, they lost their jobs. They could not afford treatment. And that happened a lot in in certain minorities like the African American and the Latinx communities that we know they were the hardest, the most hit with the pandemic. And so all these things, unfortunately, had an impact on the community because the severity of depression and the level and the numbers of people having depression increased.
Thank you. Dr. Creedle, what are your thoughts?
Yes, so there definitely is help out there for people suffering with depression. I don't want to invalidate how difficult it can be to find those things. But the people in your community that you want to look out for are church leaders, people like teachers at your school. I want to think of, firemen, anybody who is responsible for, for the safety of other people. Go to those people. I know it's hard to ask for help, but going to those people, explaining that you need help. You need to be connected with resources. I think about if you have a primary care physician, if you have a doctor or nurse that you're aware of, go to those people, tell them what your need is, and try to get them to connect you to some resources where you can talk about depression. And especially nowadays, there are lots of online. If you're fortunate enough to have access to the internet, there are online support groups that you can use to connect with people who might also be supportive and be able to give you resources. So I think the thing is to connect and open up, share your pain so that you can receive the services that would be helpful to you. And my understanding of how COVID-19 has impacted depression in the communities that I worked with is, I think, again, the thing that's really important to me when I think about depression is this isolation sort of thing. And connection is what COVID-19 has really stopped, has really pulled up from under the rug from people's experiences. They're not able to go and visit grandma. They're not able to go and see their friends. They're not able to go to funerals. They're not able to go to funerals to help people to mourn the loss of their loved ones. And this compounds the symptoms of depression that people are experiencing.
Thank you. These are very important perceptions. Listening to all of you has made it apparent that depression in itself is a huge challenge. On top of it, COVID-19 has impacted it in a rather harsh manner. I realize we have a lot of picking up to do. This has been a great food for thought session. For this discussion, it's quite evident that the experiences are different, the manifestations of depression are different, and so the roads to healing must also be different. After all, no two people are alike. However, the patterns are similar. Speakers, you're very courageous presenters to talk openly about your experiences with depression. This in itself is the first step, as depression is indeed very real and it can affect anyone at any time, irrespective of race, gender, age, culture, and ethnicity. It needs to be dealt with, and the stigma associated with it needs to be removed. Stigma only delays the recognition of that depression and its horrific outcomes. A big thanks to the healthcare professionals who have provided tremendous insight into this darkness called depression. Folks, help is now available. Remedies are many, and the pathways to healing and recovery are plenty. After the production of HERstory, the same panelists will assemble and talk about their varied journeys to healing. However, they warn us that there are no miracles, and it is not an easy process with simple answers. Rome was not built in a day, and so too the mindset takes time. Please be patient with yourselves, is the message I'm getting from the panelists. Being an optimist, I foresee a future filled with stories such as HERstory, where her, the heroine, shows us that pursuing her passion for dance helped her to heal. We now present a sneak preview to our dance production, HERstory. Nrityalaya, the School of Indian Classical Odissi Dance in Potomac, Maryland, USA, presents HERstory. This multimedia conception will use the storytelling features of Indian classical Odissi dance, appropriate verbal explanations, and audiovisual effects to portray the story of a woman's struggle to overcome and heal her depression by rekindling her passion for dance.
I went through many challenging situations as a child and a teenager, including several rejections. As I grew into adulthood, I struggled with my inner demons.
Snap out of it.
Just deal with it.
I asked, "Show me. How do I do that?" Seeking help made me realize that I could rekindle my passion for dance to heal. Coming soon in fall 2021. HERstory, a dance production that revolves around the story of my life. While dance is my passion, what passions can you pursue to heal?
Viewers, HERstory will be presented in the fall. Needless to say, we are very excited to have you join us as we explore HER's journey through depression and her healing process. Thanks for your patience. Thank you, panelists, for an animated discussion in this third episode of the Nrityalia webinar series, Pursuing Passions to Heal, titled HERstory and Our Story. This much-needed discussion has left us with many points to consider and ponder over, as these are indeed very important conversations. You will find the names and emails of the healthcare professionals who have participated in our panel today here. They would like us to understand that no one is alone, so do not give up, as help is only a click away, as they say. Thank you, viewers, for joining us for this very pertinent discussion today.
Viewers, stay tuned for the next episode that will air on YouTube. It will include another diverse panel that will present their stories and different viewpoints. Please help us spread the word. We definitely welcome and encourage participation in our webinars. So if you're interested, please send an email to nrityalia@hotmail.com with your name, telephone number, and email so we can contact you. Please put Nrityalia webinar series in the subject line to alert us to your interest. The credit for the webinar series goes to the Nrityalia webinar team. Please check our website at www.odysseynrityalia.com for updates. See you at the next webinar on September 11th, 2021 at 10:30 a.m. Eastern Time. This is Dr. Chitra Krishnamurthy signing off from the third episode of the pre-HERstory webinar series, Pursuing Passions to Heal, titled HERstory and Our Stories. Thank you.